We designed Vagercise so you can choose your own pelvic floor adventure with the guidance of our physical therapists. In this video, we'll help you decide which classes are right for you. First, a couple important notes. These videos are educational and don't contain medical advice. Be sure to get clearance from your doctor before beginning any exercise program. And seeing a pelvic floor PT in person is always the best way to assess your unique needs. We recommend that everyone start with these classes regardless of the issues you're experiencing. Pelvic Floor 101 gives a brief overview of how your pelvic floor works and what happens when it doesn't. The pelvic floor assessment helps you determine whether your pelvic floor is weak, tight, or both, and it walks you through checking your muscles at home. And breathing, posture, and core essentials. I know some of these classes might sound a little boring, but your breathing, your everyday posture, and the way you engage your core all make a huge impact on your pelvic floor. And improving these factors alone can improve your pelvic floor symptoms. Then, depending on the issues you're experiencing, take some of these 5-minute introduction classes to help you understand what's going on in your body. Bladder leaks, pelvic pain and tension, pelvic organ prolapse, an issue in which organs have dropped into the vagina, diastasis recti, which is the separation of the abdominal muscles, pooping problems covering issues like constipation and leakage, and lower body pain because the pain or tightness in your back, hips, or tailbone might be related to your pelvic floor. Check out the problem-solving section to find action-oriented tips for specific situations like these: leaks with sneezing and coughing, jumping, lifting, and running, urinary urgency and overactive bladder, painful or unsatisfying sex, and more. Once you've determined your needs, choose from these exercise classes. Pelvic floor strength, featuring Kegels and other strengthening exercises with 6 levels of difficulty. Musical Kegels with exercises set to the beat of the music. Core strength with 6 levels of difficulty for issues like pelvic floor weakness and diastasis recti. Hip and glute strength with 6 levels of difficulty. Return to high-impact exercise for transitioning back into activities like running or cardio classes, Pilates for added core strength, stretching and mobility with classes for releasing tension in your pelvic floor, back, and hips, and relaxation and yoga with classes that help you calm your nervous system and your pelvic floor. Everyone's body is different, and you may want to take classes from multiple sections. For example, you may be focused on strengthening your pelvic floor, but we also recommend taking relaxation classes to prevent your muscles from becoming too tight, just like you would do a cool down and stretch after a run. After you've been cleared by your doctor, you can take Vagercise classes at any time in your postpartum journey, whether you had a baby 6 weeks, 6 months, or 6 years ago. We designed the classes to give you flexibility with your needs and your schedule because we know your life is busy. Most exercise classes are 5 to 15 minutes. The strength classes have different levels of difficulty, but they're self-paced. Remember, changing your muscle tissue takes time. You're not going to get 6-pack abs after only a couple weeks at the gym, and rebuilding your pelvic floor is no different. But as long as you commit to exercising consistently and don't experience any setbacks, we think you can improve your symptoms in about 6 weeks. Here are some scheduling guidelines to consider.
For bladder leaks and other issues caused by pelvic floor weakness, take the 6 levels of classes designed to strengthen your pelvic floor muscles, along with the core and lower body strength classes. We also recommend doing pelvic floor relaxation or yoga after your Kegels. Here's a look at our class recommendations. Pelvic floor strength, 3 classes per week. Core strength, twice a week. Hip and glute strength, twice a week. Pelvic floor relaxation, 2 to 3 classes a week. Overall, we recommend about 60 to 90 minutes of exercise weekly for at least 6 weeks. Depending on your schedule, you could take 1 or 2 short classes every day, or you can stack classes together to make a longer workout. For example, create a 30-minute workout by taking classes for pelvic floor, core, and hip and glute strength, followed by a relaxation class. These recommendations are a starting point. I often tell my patients to do Kegels every day, as long as they aren't feeling any signs of tension or pain. Recovering from diastasis recti and prolapse takes time. Some women may need weeks of consistent exercise, and some may need months. For these issues, we recommend maintaining a schedule like this, with 1 to 2 hours of exercise per week until you are seeing improvement. Pelvic floor strength, 3 to 4 classes per week. Core strength, 3 to 4 classes per week. Hip and glute strength, 2 classes per week. Pelvic floor relaxation, 2 to 3 classes per week. If you have prolapse, repeat the Kegels for prolapse class until you start seeing improvement. For diastasis, you may want to repeat the early levels of core strength until you can do exercises without issues like coning or doming in your abs. See a pelvic floor PT for more personalized recommendations if you aren't seeing any changes after 3 to 4 weeks of consistent exercise. The tension and pain you feel is unique to you and your experiences, so it's important you listen to your body as you make the class schedule. But if you work on your symptoms 5 or 6 days a week, you should see improvements in about 6 weeks. The class choices will be different for everyone, but your weekly schedule might incorporate stretching and mobility classes specific to your issues like pelvic pain, hip pain, or back pain, 2 to 3 classes per week, relaxation and yoga, 2 to 3 classes per week, and using a pelvic pain tool like a dilator or a pelvic wand 2 to 3 times per week. Of course, feel free to do more if you can. If these classes and tools are helping you, you can use them every day. After you resolve your pain and tension, consider starting the strength classes too.
You'll always be postpartum, but you don't have to take Vagercise classes for the rest of your life. Our goal is to help you prepare your pelvic floor for the activities you used to do and want to do. After you've completed the core strength series, try the Pilates series to further challenge your core and prepare for mainstream classes at your gym. If you want to get back into running, tennis, or cardio classes, consider the Return to High Impact Exercise series for advanced strengthening. Your pelvic floor and core will always be a work in progress, just like you probably won't retire from doing squats or bicep curls. After your symptoms improve, we recommend continuing exercises at least once a week. That's it for our class overview. So let's get started.